The TREC Trial, 2020, a landmark in early-stage rectal cancer management. Welcome to our discussion on one of the most significant milestones in the management of early-stage rectal cancer. Today, we are exploring the TREC Trial, published in 2020, which challenged the traditional paradigm of radical surgery for rectal cancer and illuminated new possibilities for patient-centered care. Let us begin by framing the motivation behind this research. Traditionally, patients diagnosed with early-stage rectal cancer have faced the prospect of total mesorectal excision, a major surgical procedure. While this operation is often curative, it carries profound risks, including the possibility of a permanent colostomy, as well as bowel, bladder, and sexual dysfunction. The question posed by the TREC trial was both bold and compassionate. For those patients whose tumors seem to be completely eradicated through organ-preserving chemoradiotherapy or local excision, could a non-operative, watch-and-wait approach be just as effective, and perhaps gentler on the patient? To set the stage, the TREC trial was an open-label, randomized, controlled clinical research effort. 55 individuals with early-stage rectal cancer, specifically those with tumors classified as T1 to T3b, no distant metastases, and either no or minimal lymph node involvement, were recruited. These were patients either at high risk for surgery or those wishing to avoid a major operation. The trial compared two main strategies. The first group received chemoradiotherapy and, if they achieved a complete clinical response, entered a rigorous surveillance protocol with regular endoscopic and magnetic resonance imaging follow-ups. The second group underwent standard surgical resection, with or without preceding chemoradiotherapy. It is important to note that while there was a third arm involving local excision, the primary focus was the comparison between the watch-and-wait method and surgery. Now, let us turn to the remarkable findings. The TREC trial demonstrated, first and foremost, that it was feasible to recruit patients for such a comparison, something previously thought nearly impossible, given the radical departure from standard care. Within the group assigned to the watch-and-wait strategy, approximately 68% of patients who underwent chemoradiotherapy achieved a complete clinical response and entered the surveillance protocol. Impressively, 3 years later, every single patient who had reached this milestone was still alive and free from disease regrowth. But the significance of these findings does not end there. By choosing the watch-and-wait route, 92% of patients in that group successfully avoided major surgery. When the outcomes of survival and disease recurrence were compared between the groups, there was no statistically significant difference at 3 years. In other words, carefully selected patients did not sacrifice cancer outcomes in exchange for organ preservation. What about the risk of the cancer returning? In the watch-and-wait group, a small number of recurrences did occur. Specifically, 2 patients, or about 11% of those with a complete clinical response, experienced local tumor regrowth. However, these were promptly identified through scheduled surveillance and were treated successfully with salvage surgery, after which there were no further recurrences. This aspect underlines the importance of carefully structured and consistent follow-up for patients on a non-operative trajectory. Of course, as with any research, there were limitations to consider. The TREC trial was relatively small, with only 55 participants, and its 3-year follow-up, while promising, is not sufficient to make definitive claims about long-term outcomes. The trial participants were carefully chosen, with favorable tumor characteristics, meaning that these results do not apply to all individuals with rectal cancer. Furthermore, the nature of the interventions precluded blinding, which is an inherent challenge in surgical studies. To summarize, the TREC trial stands out as a pioneering study that has shaped modern clinical practice. It provided the first randomized evidence supporting a watch-and-wait approach for early-stage rectal cancer patients who achieve a complete response to chemoradiotherapy. This strategy allows many individuals to avoid the lifelong impact of major surgery and a permanent stoma, all while maintaining survival rates comparable to those who undergo radical resection, at least in the short to medium term. However, the study also underscores the necessity for close surveillance and the readiness to intervene with surgery should the cancer return. In closing, the TREC trial has transformed a once experimental concept into a legitimate standard of care option for appropriately selected patients, thereby advancing the field of rectal cancer management in a direction that prioritizes both survival and quality of life. Thank you for joining us in this exploration of the TREC trial and its implications. Stay tuned for more deep dives into pivotal research shaping the future of oncology. It's the Everything Surgery Podcast. Dissect the extraordinary.